Good morning and hello everyone. Bienvenue, Akichiyu Shikin, Tanzi, and Anin. My name is Jane Curtis, CEO of Southern Health Santé Sud, and it's my distinct pleasure to be here today. Together, we acknowledge that Southern Health Santé Sud is located on the original lands of Treaty 1 and Treaty 3 territory and on the homelands of the Métis Nation. We respect these treaties that were made on these territories and acknowledge the harms and mistakes, specifically the legacy of the residential schools. In solemn joint mourning for the lives of the many children found across the country and the potential for others to be discovered, Southern Health Santé Sud affirms our commitment to responding to the Truth and Reconciliation Commission of Canada calls to action 18 to 24. As an organization, we aim to embrace the distinct cultural knowledge, practices, and traditions of the Indigenous people and continue efforts to strengthen relationships with the Indigenous communities and peoples whom we serve. Without further ado, I would like to call on the Honourable Audrey Gordon, Minister of Health, Seniors and Active Living, and Minister of Mental Health, Wellness and Recovery to the podium for an exciting announcement. Minister Gordon.
Good morning, everyone, and thank you, Jane, for that introduction and for joining us here today. It's a pleasure to be here today for a significant announcement about the future of healthcare in this community and within Southern Health Santé Sud. I want to take this opportunity to thank the many healthcare providers and staff across the province, including the many nurses, doctors, and healthcare support staff here at Boundary Trails Health Centre. They have worked tirelessly to provide quality care throughout this pandemic. Thank you for your dedication and commitment to patients and their families, especially during these difficult times. I want to thank my colleagues, Minister Friesen and MLA Josh Gunter, for joining me today. I'd also like to thank Ben Friesen, someone I'm meeting for the first time today, Board Chair for Boundary Trails Health Centre Foundation, and Dr. Dawn Klassen for being a part of today's announcement. Welcome here. As well, I want to recognize Reeve Olafson, Mayor Harder, the Mayor of Winkler, and Mayor Burley, the Mayor for Morden, for joining us as well. Our goal to provide better health care for all Manitobans is our top priority. Our bold vision for better health care focused on reduced wait times, improved access, and more services closer to home. And together, we are taking significant steps in achieving that goal today. As part of our government's largest capital health commitment in our province's history, I'm pleased to announce today over $64 million to support the significant expansion at Boundary Trails Health Centre. This investment will help support this centre to serve as a district hub for the community and region, offering Southern Manitobans many services that might currently require them to seek care in Winnipeg or other communities. This $64 million investment will move forward in two stages. First, the construction of a new two-story community services building and inpatient building additions, followed by renovations to the existing health centre. While planning for the new building is still being finalized, it is expected to include a number of existing programs that are currently located elsewhere, including acute care areas of the health centre. This may also include such services as ambulatory care, cancer services, home care, education services, public health information services, and administration. Construction of the new building to be located adjacent to the current health centre is expected to begin by the summer of next year. Once programs and services have been relocated to the new community services building, renovations will begin on the vacated spaces in the health centre. This will allow for the creation of expanded spaces for several departments and programs, including surgery as well as the addition of a retail pharmacy. Our government is investing in better health care, and we're investing in the health and well-being of people and communities in rural Manitoba. Thank you.
Thank you, Minister Gordon. And now I would like to invite the Honourable Cameron Friesen, Minister of Justice and Attorney General, and MLA for Morden Winkler, to say a few words. Minister Friesen.
Thank you, Jane. Good morning, everyone. Minister Gordon, thank you. Merci beaucoup. C'est un grand plaisir d'être ici avec vous aujourd'hui pour faire cette annonce très importante pour notre communauté. It's just a pleasure to have you here in Southern Manitoba. MLA Josh Gunter, Mayor Harder, Mayor Burley. I see Deputy Reeve Ike Friesen here, no relation. Also to Ben Friesen, no relation. And to Dr. Don Klassen and any other Friesens I'm not related to. It's just an absolute pleasure to be here today. I also see the CFO Ken Klassen in the room today. I see Kyle McNair over there. So many stakeholders, so many partners. I see shared health partners here. It's a delight to be at this day with all of you. I was driving home from Winnipeg yesterday after a late night of voting on the budget for Manitoba, and a country song came on the radio, and I don't listen to country music. And it went like this: it takes a little time sometimes, so give it time. And I think it's a great message for us in Southern Manitoba, because it has been a long time getting to this date. I remember early on when I was the MLA, elected in 2011 for the first time, and I had a tough meeting with Boundary Trails Health Center Foundation. And one of their representatives sat in my office and said, "We just want to know right now if we can get this new health center. And if the answer is not yes today, we're out." And I said to them after reflecting, you know, I am so glad that in the lead up to 2001, in the 10, 20 years that preceded that time in which doctors and nurses and administrators in this community were talking about a vision for consolidated healthcare delivery on one campus and in one facility, I'm so glad they persisted. Because it was that persisting that got this facility opened at $35 million in 2001. And the foundation was there. And it was that persistence by the community and the foundation that got our very first MRI open on this site in 2007, with a contribution of almost 50% coming from the community. And it was that contribution that got other investments into this place. And I cannot tell you what a partner that Boundary Trails Health Center Foundation has been. I thank them for their assistance in getting to this day. Let me sum up with this. When I was made the Minister of Health, it was 2018, and one of my very first speeches, and some of you were there, I think Bartley was there that day. We were at a ballroom in downtown Winnipeg, and they said, "Quick, Minister, tell everyone about the Clinical Preventative Services Plan and the plan for the future." And Minister Gordon, I think I had been the minister for about a week. Olivia, you were there too. You're somewhere in this crowd. I remember going to that room, and I had read the plan, and I said, I actually believe in this plan. It was bold, it was written by people like Dr. Don Klassen, 200 clinical leaders across the country. What was different was it wasn't a bunch of politicians around, sitting around and saying this is what needs to happen. It talked about better care closer to home for all of Manitobans. And that plan contained an important vision for this place because we're growing. When this place opened, we were delivering 400 babies a year. Now we deliver 1,000 at this place. We have obstetrics, we have oncology outpatient program, we have a successful surgery program, we have all kinds of programs that are operating out of here, dialysis that just got expanded. But we are growing, and we need that acknowledgement of growth, and that is what today represents. So on behalf of the grateful people of Southern Manitoba, Minister Gordon, we are excited to get to this day. We know that the future is going to mean that more patients in southern Manitoba can get their care closer to home. We know that it will be a more appropriate care, a quicker care, and that is, I know, the kind of change that you are facilitating in your role. Thank you for your many hard and long days right now. Thank you for your leadership and your persistence, and thank you for this excellent announcement. Boundary Trails Health Centre Foundation, thank you for your partnership. It's an excellent time to be at the podium with you today.
Thank you, Minister Friesen. I would like to acknowledge and express sincere thanks as well to the Province of Manitoba and Manitoba Health and Seniors Care, who have partnered with us along on our journey. Know that this enhancement will enable better services and quality of care to the citizens of this area and beyond. Thank you to our provincial partners. Dr. Don Klassen is a family practice anesthetist employed at CWE Medical Center and has been providing services at Boundary Trails Health Centre for 43 years. He started when he was 10, right? I would like to welcome Dr. Klassen to the podium.
Yeah, 10 or 15 or something like that. Thank you, Jane, and good morning, everyone. The past 19 months have been challenging for all of us. It is such a pleasure to change the topic today and to be alongside the minister and ministers and all of you as we move forward with a plan that will continue to improve healthcare and benefit our communities long after the pandemic is a distant memory. As Jane mentioned, I'm a family physician, anesthetist, and I work in this community, including here at Boundary Trails. My good colleague, Dr. Murray Reimer, is covering the OR for me this morning while I'm here. I'm going back after the announcement. I also had the good fortune to be involved in what Minister Friesen referred to, the Clinical and Preventative Services Plan. The clinical plan represents a smart, coordinated, patient-focused investment in the health of Manitobans with the goal of making more care available to the citizens of our rural communities. Anyone who lives in rural Manitoba can likely recall a list of situations over the years where they or someone they know have had to travel to Winnipeg to access health care services not available here. Those who have experienced these circumstances firsthand often end their story with the line, "I wish I could get the care I need without having to travel elsewhere to get it." Of course, there will always be instances where travel to hospitals in our bigger cities is necessary to access more specialized care and services not available locally. But today's announcement means that many of us living in Winkler, Morden, and the surrounding areas will increasingly be able to get the care we need closer to home. I want to thank the Manitoba government and the Boundary Trails Health Centre Foundation for their partnership in an initiative that supports ever better patient care and access for people of this region. Their investment will result in more inpatient beds, a wider array of services, and more space for patient care programs at Boundary Trails to support the healthcare needs of the people who call this area home. And it will very much continue to pay dividends to our growing communities well into the future. Thank you.
Thank you, Dr. Klassen. The Boundary Trails Health Centre Foundation has been a committed partner for many generations. Their vision and mission has remained solid and unwavering. They support us in enhancing, enriching, and maintaining a high level of safe, quality health care. It's a privilege and a pleasure to work in partnership with the Foundation. I would like to call on Mr. Ben Friesen, chairperson of the Boundary Trails Health Centre Foundation, to speak. Mr. Friesen.
Thank you, Jane. Thank you, Minister Gordon and Minister Friesen, as well as MLA Josh Ginter, for attending today's announcement. As the chair of Boundary Trails Health Centre Foundation Board of Directors, I am very pleased to be here today, as well as very excited for the announcement. This is a significant day here at Boundary Trails, and for the people who live in Morden, Winkler, Arm of Stanley, and all the surrounding communities. We are one of the fastest growing areas in Manitoba, and as a community, we understand the need for enhancing care available locally. As Boundary Trails has evolved into a regional health centre, serving the needs of southern Manitoba and the province, the Foundation has been aware of the need for additional healthcare space for many years, as has been mentioned earlier. Through a partnership struck in 2018 with various healthcare stakeholders, including Jane, Ken Klassen, I see Kyle McNair is here, was very, very instrumental, all of Southern Health, we developed a plan to redevelop Boundary Trails Health Centre. That would address those needs. While developing this plan, we met with a number of leadership teams from physicians to frontline staff to maintenance to inform our work. We also took into consideration the current population of our communities that access care here, as well as the projected growth for the catchment area. Today's announcement brings those recommendations together with recommendations from Manitoba's Clinical and Preventative Services Plan to ensure that our healthcare facility can provide more high-quality care right here, now, and into the future. The Foundation has actively supported many significant projects over the past 20 years here at Boundary, services that would enable members of our communities to access the care they need closer to home, including raising funds for the MRI Centre, the expansion of our palliative care program, the E&I Cron heliport, and ongoing annual support of the various supports and services delivered every day. I would also like to take this opportunity to thank all the staff, not only here at BTHC, but across Manitoba, for the tireless efforts over the past difficult 18 or 19 months that we've had. Their services have been greatly appreciated. On behalf of the Foundation, we are proud to be a partner with the province on this meaningful project that will add a new building equipped with more space for the services our community needs while enhancing our acute care capacity. Thank you.
Thank you, Mr. Friesen. So it's been said at the center of Manitoba Health System transformation is the development of the Manitoba Clinical and Preventative Services Plan. As a region, together with the province and many frontline clinical leaders, such as Dr. Klassen, we have been privileged to work on this Made in Manitoba plan to deliver better health outcomes. Planning is aligned with principles that will support better patient care and sustainability of the quality care offered now and into the future. This new investment in acute care inpatient beds and additional space for patient care programs will strengthen the network of resources that makes Boundary Trails Health Centre an important hub of medical services. It will ensure that we continue to meet the long-term needs of this growing area with access to high-quality, specialized care that is closer to home. It's been said before, and I don't think we can say it too many times, I would like to recognize the work of our healthcare teams across the region and province for their valuable work in these most difficult, challenging times. We want you to know that you're appreciated for all that you do. Thank you. And last but certainly not least, communities represent the diversity of our region. I would like to sincerely thank the cities of Winkler, Morden, and surrounding communities. Your support shows that all things worthwhile are possible. So this concludes the formal portion of the program today. I would like to invite media to ask questions specifically related to the announcement. We will then be doing a photo op, and there will be an opportunity after that to ask of other topics. So thank you very much.
Ms. Curtis, how long will it take for both phases of this to be completed?
So it's going to be started in 2022, and I think it'll probably be 2025? 2024. So the summer of 2022 is the start.
What medical services will people still have to go to Winnipeg for that once this is done?
Well, obviously, those medical services that Health Science Centre provides that really no one else in the province does. So the specialty surgeries and care. But we'll be providing many of the services that we currently provide, but able to handle bigger volumes as we know our population continues to increase. So as that evolves, we'll hopefully be having more services and able to handle more population.
Is there any idea of like how many trips to Winnipeg this will stop? Like how many is there?
You know, that's a really good question. I don't think we'd know in terms of numbers of travel, but I think there's two things. I think there will be less trips, maybe less longer trips, but also just the population needs so that the wait times aren't as long as well.
I guess how big was the need for this expansion? I've been working on it for a while, but could you quantify the need for this?
Yeah, so I mean, I think Dr. Klassen said it when Boundary Trail was built in 2001. It was already being stretched. So the population growth has been one of the highest in the province, and so those discussions started very soon after Boundary Trails opened, and knowing that eventually we would need more space. So this has been a long time in the making. Trending continues to predict that our population will continue to grow, and so I could probably say for the last 9 or 10 years there's been discussions around this plan.
When this expansion opens, will it also be stretched immediately, or will there actually be a bit of a buffer between it opening and getting that capacity?
I think the plans are very accurate, and I think they've been carefully designed to look at not just the needs for today, but the needs for the future. Of course, you know, you can't predict everything that happens, but I also know that we have additional space for the future if things do need to be added on at that time.
Minister, first of all, I understand what can you tell us about what proportion or what numbers of frontline healthcare workers have yet to be vaccinated?
Thank you for the question, because it gives me an opportunity to thank the thousands of healthcare professionals that have rolled up their sleeves not once but twice to get fully vaccinated. Thank you so much for your efforts. The data continues to come in. As you know, we have until Monday to gather all of that information. It has started to come in, and it is a high number, and we thank those individuals. So I don't have the exact number for you. Hope to have something by the end of the day, but the numbers and the data has started to come in.
But are we talking about hundreds, thousands of healthcare workers who are vaccinated? What's the ballpark? Because I know you do have a ballpark already. You mentioned the data was coming in a couple of days ago. So what's the ballpark?
Was your question that are not vaccinated? So there are pockets all across the 5 regions, and so it looks like there's a small number in terms of the 42,000 healthcare professionals that are direct care workers. I would consider it not a large number, but there are individuals that remain unvaccinated.
What does that look like in Southern Healthcare? We're hearing it could be up to 30%.
I don't have that percentage. I have not heard that. We do have, as I said, pockets, and Southern is, of course, one of those areas. And we continue to work with Shared Health and the leaders of the Regional Health Authority to communicate information regarding testing, the science behind the effectiveness of the vaccine, to allay the fears of individuals who are still vaccine and testing hesitant.
This mandate goes into effect on Monday.
Yes.
How are you making contingency plans right now? We have care homes that are already saying we're going to need help from family members to come in and feed for their family members, clean their rooms, do their laundry. How is that contingency plan?
There are many contingency plans that are being looked at right now, and one of them is to to make family members aware that their assistance may be required, but that doesn't necessarily mean that that will be the case. But we certainly wanted to make the family members aware that that is one of the contingency plans that we may need to put in place.
How concerning is it to you that there are healthcare professionals in this province after 19 months of COVID-19 that still refuse to either get vaccinated or in some cases now even refusing to get tested to the point where they're willing to walk off the job? How concerning is that for you?
You know, this is a time for compassion and kindness and listening and understanding and realizing that there are myths out there and a lot of misinformation. And our job is to dispel those myths, to remove the barriers that are preventing individuals from getting vaccinated or wanting to be tested. So what I say to those individuals is that we will stand shoulder to shoulder with you in terms of helping you to navigate some of the issues around the unwillingness to be vaccinated or testing. But again, this is not a time for shaming or blaming. It's a time for understanding and compassion.
Should those healthcare professionals, though, have more access to that actual information than anybody else in terms of proper information?
They do have access to that information. We have been rolling it out in terms of in forms of videos, in forms of paper materials. Managers are meeting one-on-one with those individuals, and we will continue to do that.
How many people do you expect to refuse both the vaccination and the testing option?
I'm sorry, repeat the question.
How many healthcare workers who are frontline are you expecting to refuse both the vaccinations and the testing?
I do not have the final number. The data, as I mentioned before, is still coming in. Actually, healthcare professionals are going online or meeting with their managers every day and updating that information. I think it will be a small number. So,
a memo that went out that said, look, if you don't get tested or vaccinated, you're not going to get paid, you're not going to get time off, you can't use a sick day, you can't use any other means of getting away from this, you're just not going to get paid. Can you comment on that this week?
That is a memo that went out by Shared Health, who is the employer, and they have communicated this. This has been shared with all the unions representing these individuals, and they feel that that is necessary in order to address the spirit and the language in the public health order, which states that you're fully vaccinated by October 18th, or you are going to submit to regular testing.
Mr. Gordon, what about Saskatchewan? Have we heard from them do they need help with ICU care for them?
So we are in discussions with Saskatchewan. No final ask has been confirmed, but they are discussing with us our ability to help them if the need arises. And we're part of a federation. And they helped us in the spring, and if we're able to assist, we certainly will do so.
Are there plans to bring people from other health regions into Southern Health, medical professionals to help out in Southern Health regions?
So we are looking at many different contingency plans at the moment. I actually have a meeting later today with the Southern Health team and the Chief Nursing Officer for Shared Health, and we're looking at a number of different options, and we will weigh those options depending on what we find out on Monday.
Should these plans not already be in place? We're 3 days out from this. Why do we have no solid information plans that you can share with us on numbers or exactly what's going to be happening?
Well, plans are in a state of flux. So, and it really depends on where the pockets and the greatest need is. And so there are draft contingency plans. We have talked through the step model for addressing the needs and the areas that will require supports. So those are all being discussed. Of course, we have to wait to see what the final numbers will be and what the need will be.
Are you committed to releasing those numbers?
Well, I've asked for the data. We should be able to have something for you later today, but firm numbers by Monday, which is the deadline.
All right, last question. What is the province doing to combat? We have the highest infection rate now in Northern Health. We've got a big outbreak in Norway House, the fast globe radiation, as well as resurgent one in the Shamato and Pascal.
Yeah.
What are you doing? What you personally, but what is the province doing to combat that resurgence of cases in the north, which now has provinces?
Well, we are working very closely with the Vaccine Implementation Task Force, Dr. Rusin, our Chief Public Health Officer, and Dr. Anderson, who led such a successful vaccination program throughout the North. And we are looking at the numbers. We're deciding on, as you know, we recently approved dose 3 for First Nations personal care homes. We're looking at possibly broadening that, but no final decision has been made yet.
Do the rapid access for addiction medicine program, does that need to be expanded? We're hearing that people repeatedly try to get in, they're getting turned away. What are we going to do for these people who are ready for help, but there's no room for that at these rapid access?
Well, the COVID pandemic has impacted the mental health and addictions sectors as well, having to reduce the number of beds as a result of social and physical distancing requirements. And our rapid access for addictions medicine clinics have also been impacted. The numbers have increased significantly. As you know, our government this spring expanded the programs in the 2 Winnipeg RAM clinics by the amount of, I think, a little over $800,000. My departmental officials, myself included, is also going across the province. We are speaking to healthcare leaderships, healthcare experts, individuals with lived experiences, to hear how we change the system, how we improve access to and coordination of services in the mental health and addictions area. RAM Clinics is just one of the tools in our basket of services. There are many others at the community level and at acute care facilities as well, and we will look at how to build a better and stronger network.
Okay, thank you very much, folks. Thank you. Thank you, Thank you very much.
Yep. Sorry.
So similarly, do you have an indication for your health region, what kind of numbers we're looking at that are vaccinated, and what we think the rest of the?
So I think the reason we're not able to give you a hard number is we have a really good idea about who is vaccinated. But there's another part that we're trying to determine, and that's because people are in flux right now. They're trying to decide about vaccination, and if they've made that decision now, they're trying to decide about testing. So that number is fluid. I would say that although perhaps regionally or provincially the number is this, I would say that all of our managers are working day to day with their staff. They're having conversations all the time. They do have a really good idea about who is vaccinated, who is not vaccinated, and who will be tested, and then those that don't are unsure about vaccination and being tested. So the managers on the sites know through those discussions. The data helps, absolutely, but that's just one source that we're looking at. We also need to have those conversations.
What happens on Monday when some places may not have enough staff to work? Specifically, then, what is as my colleagues asked, contingency plans for Southern Health for Monday?
Yeah, so we've already put some contingency plans in place. We have staff on standby that can be redeployed into sites if it starts looking like we are not going to have enough staff to care. We're looking at things as simple as our menus and ramping down some of our menus so that they're easier recipes to produce if we need to. So these are all things that are in the wings. We're not implementing them until we know we have to, but everyone is sort of prepared to do that.
So what do you mean by we're ramping up menus?
So recipes that maybe take more workload to produce versus other food products, those types of things.
You might not have kitchen staff.
Yeah, we know that we're going to have a portion of our kitchen staff. I mean, we have a lot of confidence that we know who's going to come in because they've told us. So it's that last little percentage that we're waiting, and but those would be examples of some of the contingency plans that we have in place. There's many, and as I said, we're really hoping for the best, but we are making sure that we also have those plans in place if we need to implement.
I know you can't say how many people, but can you say like which departments might be the largest affected? You mentioned the kitchen, right? Is it home care? Is it technicians, lab? What departments might be?
I would say it's all over. It depends on the facility. It depends on the place. I don't think I could say it's one department over another. I think this just reflects that vaccine hesitancy that we've seen in all pockets of our populations. It doesn't belong to one group or one demographic. It's across the board.
What do you say to families who have loved ones in care homes right now who are receiving these letters saying, we're going to need you to pick up the slack? Maybe they don't have time to pick up the slack. They work full time. They have other things that they do, and they have put their families and loved ones in these facilities to care for them. What do you say to them? They're frustrated.
It's an excellent question, and I just want to say to those families that we will take care of their loved ones. The requests that went out are for families that perhaps do have some capacity to help. And, you know, just even in normal times, families are a really important part of our care team. These are the residents' homes, and families are part of that home. So it's not unusual to have families in on a daily basis. So we would never put a family into a position where they'd have to come in, but we do know there's families out there that would be willing to and happy to.
What about the added risk of bringing in dozens more people to come in and help out with their loved ones? They might be vaccinated, yes, but there's still a risk if they're wandering around Southern Health, which has a low vaccination rate, and we have high COVID numbers. There's a risk of bringing COVID into these facilities.
So we would put them under the same conditions as anyone else that would come into our facilities. They would either need to be vaccinated or they need to be tested.
But you're still adding risk by bringing dozens of people in who could be asymptomatic even if they are vaccinated.
I think the risk would be a lot lower than not having them there.
How many homes are we talking about in Southern Health that are facing a shortage currently?
Sorry?
How many personal care homes in your region are in this situation?
I would say that probably the Salem Home and Tabor in Winkler Morden. That's probably where the most focus has been at this time. But we know there's pockets across our region, and we're working at all of our sites to make sure that we're talking to staff. We know who's coming in on Monday. We've been double checking and triple checking, and we'll just be monitoring the situation extremely closely.
Time for one more.
Shortages outside of the personal care home, are we looking at these shortages in hospitals, other healthcare facilities, that people coming to care?
Yeah, so I'd say it's across the board. It doesn't just belong to one sector or one program area. I would say that, you know, we've definitely identified sites that may be in a more challenging situation than others, and but yeah, this is across the board. It doesn't belong to one sector, one demographic, one population group.
Last one.
Sorry?
Do you have a message for people in this community who aren't yet vaccinated?
I would say just seek out credible information. Talk to a trusted care provider, someone that maybe you've known for a long time. There's a lot of misinformation out there. I see it every day. I'm sent things every day. I know how confusing it is for people. I know how fearful people are. And I would say that, you know, if you're unsure, please reach out and talk to someone who works in the industry and knows the science behind it. I think that's really important, and I can't say that enough.
Thank you, everybody.
You need it or you good?
Oh, I do have one. Thanks very much, Mr. Minister. There's been a lot of about the additional enforcement that have been requested by Ms. Morden, and some other officials here at Southern Health, and your colleague, the health minister, has deferred to you. Given that there is an additional retail restriction here, now an additional quarantine restriction, what additional specific resources on the enforcement side or the collection side for the people who already receive funds is there going to be for communities in Southern Health where they're having adherence issues?
Well, I'd say that those enforcement resources are in place. As you know, we have more than 3,000 enforcement officials across the province who are designated, trained, and out there actively enforcing the COVID restrictions. This includes RCMP, police, bylaw officers, conservation, LGCA officers, and many, many more. And as you know from looking at those weekly statistics, the number of tickets and the number of warnings is continuing to climb. As a matter of fact, from the baseline in early August, that number of tickets has continued to climb. And I would say there is that correlation between the cases and enforcement issues. I mean, as the case numbers go down, things do settle. As restrictions increase, so does the obligation and responsibility to enforce. So I would first of all say that is happening. I would tell you, secondly, it's happening dynamically. That we are both making sure that we are out in all communities to make sure that there is compliance with the rules, but clearly where there are hot spots, that means that we must additionally be responding. I cannot give you operational details of how that occurs because it would be unhelpful as the Justice Minister, but I can tell you that those senior leaders who are charged with that responsibility are constantly assessing. They're also taking into account where there are complaints of infractions. And when it comes to the second part of your question, yes, it is important that people actually then do pay their fines. But remember, of course, that when we are assessing tickets, people do have that right within our system to have their day of court in court. And if they choose to contest the charge against them, they obviously do have that right.
What do you say to the notion that there are examples in social media of saying that there really isn't a lot of, to the end, so many of these are getting tossed or maybe at court, that the threat really isn't enough. The threat of a fine is what would you say?
Well, I'm not going to offer conjecture on that point as the Attorney General. I would say the law matters. Enforcement matters. Enforcement will continue to be a key facet of our government's response to the pandemic because it matters. When the numbers get worse, we know what the risk is, and it's important that people comply. We will continue to send officers. We will continue to give reminders. We will continue to ticket. And for repeat offenders, we will be out there in the community continuing to send that message. But when it comes to, you're talking about the specter of tickets and the degree to which they act as a deterrent, we believe it's out there. Every jurisdiction in Canada, indeed every jurisdiction in North America, is grappling with that question of how to allocate resources appropriately and adequately to respond to issues of compliance. We're all, I believe, continuing to work on how to do that better. We'll continue to do that here.
Mr. Friesen, this is your backyard. Why has it been so difficult to get that message out, to get the proper information out, to educate local people with proper information about vaccinations and convince them to get vaccinated, especially in the healthcare industry where they work?
Yeah. That's a complex question, and if we had an hour, we could really unpack that question. You know, issues of vaccination hesitancy aren't localized only to my community, but as you say, it's a fair point to say this is an area that historically has been low when it comes to vaccine uptake. I can recall, even as a newly minted Minister of Health in 2018, getting briefings that showed, and this was before the pandemic, vaccination rates differentially throughout the province. And there are these pockets where that resistance to vaccine has been more prevalent. I think some of that is cultural. We continue to be an area that has, invited a lot of newcomers to Manitoba. Part of that is I think in people's feeling of real independence. I don't think it's all about education, but education is a key component. Getting people to be in possession of good information about what a vaccine does and the level of risk. I think for myself, the most perplexing thing has been that people who are saying no to a vaccine are people who will receive health care when it comes to a broad variety. If they had a cancer diagnosis, they would trust the medical system. I think this has been so perplexing. I want to re-emphasize something that the Minister said this morning. We are finding, I think clearly in Manitoba, we're all in this together, as the Chief Provincial Public Health Officer likes to say, and that condemnation and criticism are not working. We need to find inroads. We need to find those groups of people who actually are reachable and then reach them with the most creativity and the most resources that we can.
Minister, there are companies and businesses that have been repeatedly defying public health rules. Is there any plans to shut down completely businesses that continue to break the rules?
Our government has, on occasion, through enforcement, shut down repeat offending businesses. That remains on the spectrum of action that can be taken from enforcement. Obviously, I cannot share with you operational details about when and where that's being contemplated.
Are there things that you're doing proactively to support businesses who are caught between that rock and that road?
Absolutely. I must constantly navigate, as you know, my role of Justice Minister, Attorney General, but also as the local MLA. I think for me, one of the most important things, even to the subject that Josh raised, is keeping my door open, making sure that I'm meeting with groups. There's been people in my community who have been frustrated that I've been meeting with certain groups. And I say, no, my responsibility is to meet with all of those groups and individuals, even when we don't agree, to keep those lines of communication open, to make sure that we are clear and that we're providing good information. I think that about 2 years ago, I underwent severe criticism in this province because I met with a group, I guess a year ago, I met with a group that didn't agree with us on mask use, and they saw that to be tacit approval of that group's position. Nothing could be further from the truth. We must keep the lines of communication open. A few weeks ago, I met with a large group of restaurant owners in the city of Winkler. A week ago, I met with a large group of gym owners and fitness center owners and just heard them out. I think there's more to be gained from listening than there is to be gained from shouting. Thank you, everyone.